So the latest on this coronavirus pandemic called Omicron, or I don't know why I keep saying Omicron. It's Omicron variant, so I probably am saying it correct. But it's here that I learned that a lot of things are going on with this new variant. And so what we cover here, they said the variant spreading very quickly in several countries. It's expected to become the dominant coronavirus variant in Denmark this week, even. That's how fast it has spread. So the new study from South Africa indicates that Pfizer vaccine is 33% effective against Omicron. But people infected with the variant, if they're already infected, are less likely to end up in the hospital. Meanwhile, Pfizer updated results for its experimental COVID-19 pill. So this is this pill I was telling you about that they were talking about eventually distributing to people that you could actually take it at home. So it showed that it cut the risk of hospitalization or death by 89% if it's given to a high-risk adults within a few days of their first symptoms. All right. So basically, I'm looking at this. Scientists are learning more about this new strain, Omicron variant. Here's what else to know about this as of now. And this was posted 2 hours and 13 minutes ago. So these are updated post things that are happening in real time. So this variant, this new one, it says it has been identified in 32 states at least. And so with experts like Dr. Fauci saying that it's likely to become the dominant strain in the U.S., that scientists say that they believe that Omicron is the most contagious, but has led to less severe illness so far. But as the holidays are looming, health officials from across the world are encouraging people to still get vaccinated and boosted as well. And so these are other headlines with this variant, and they follow. And it goes on to say there's different types of things going on in different countries, different states. And so this is what they've been looking at. So a South Africa study indicated that people infected with Omicron variant are less likely to end up in the hospital than those that are infected with the original virus. Okay. So this one is supposed to be a lot less. It's more contagious, but less lethal, as they claim, in terms of whether you've been infected or not. But with the other one, you were more apt to probably end up in the hospital, is what they're saying. But with the Delta, so the same study said that Pfizer and BioNTech vaccine is only about the vaccine, whether it works against this new strain, Omicron, 33% effective against Omicron variant. So Dr. Fauci said 2 shots, the mRNA vaccine, are not showing to be very good at preventing infection from this virus. But 3 shots, it does show optimal protection. So it gives you some level of protection. That's when you get boosted. Give a booster shot. And so Omicron has been growing rapidly over the last 3 weeks in the UK, leaving officials very worried about the large volume of infected people each day. So this is not US, but it's actually the UK. Their health security agency, they said that there is a higher rate of reinfections of this new strain. And so about the pill, COVID-19 pill, Pfizer said that it has an experimental treatment. And it goes along basically with what I just said, that it cuts through the risk of hospitalization and death by 89%. And so this is this pill they've been working on. If it's given to the high-risk adults within a few days of the first symptoms, think about it. If you're a person that doesn't show symptoms and you're sick with this, and it could be lethal, how do they know? How do you know to ask for help? So that's another drawback. So you have to be somebody that is symptomatic not asymptomatic, that doesn't show symptoms. So Pfizer hopes that it can eventually offer pills under the name Paxlovid. I believe that's, no, not Paxlovid, Paxlovid. So, excuse me for that pronunciation. So, for people to take it at home, like I said before, they get sick enough to go to the hospital. So, it's like, how do you know that you're even sick? For those that don't show the symptoms, that's my question on that one. But Pfizer CEO, the pill is not prevention. It doesn't prevent you from getting it. It just prevents you, well, it doesn't prevent you from getting it, but it tries to keep you from ending up in the hospital with it. So people should still get vaccinated, is what he's saying. So global vaccination efforts. Then it goes into the pandemic around the globe. So different things going on around the world. So in terms of global vaccination efforts, how is it going? Officials in Nigeria say that the country will destroy 1 million expired COVID-19 vaccines. Why? The country said that it would no longer accept vaccines with a short shelf life. So in the meantime, the World Health Organization regional officer for Africa says that it is necessary to dispel the notion that vaccines are being wasted, explaining less than 0.25% of the doses made available to the continent have expired. And so the pandemic around the globe, what's that like? South Korea has reported a number of COVID-19 patients in critical condition and COVID-19 related deaths. This was from Monday. The country reported more than 5,000. Let me change that. 5,500 new cases yesterday. You want to hear that again? Not 500. 5,500 new cases. This was yesterday. All right. That's a lot of people. So Greece also has recorded the highest daily death toll. Listen to this. This is their highest one in the virus since the beginning of the pandemic, within 130 deaths, according to the government officials. And so Italian government has approved an extension of a state emergency until March 31st next year. All right. According to the statement on Tuesday, Italy has suffered the biggest rise of COVID-19 deaths since May, with 120 in the last 24 hours. Okay. So it is steadily climbing in some areas. Vaccines prevented more than 1 million COVID-19 deaths. Okay. So this is 2 hours and 44 minutes ago in the U.S. study estimates. And so they are constantly on this. It said it prevented more than 1 million COVID-19 deaths, more than 10 million hospitalizations in the U.S. study published on Tuesday. This is by the Commonwealth Fund estimates. Model also predicts that there would be or would have been nearly 36 million additional infections through November 2021 in the absence of the vaccine. So basically, they want you to still pursue getting vaccinated, because they say that at any point that this gets even worse, which it will, is what it's looking like, and it started, that the vaccine is the only level of defense that they can offer people to try to protect themselves the best way they know how. So most of the deaths and hospitalizations that the vaccine helped to avoid would have occurred in the late summer and early fall of the Delta variant, which was a lot more deadlier than this Omicron. But I just want to reiterate within all of this that this new strain also comes with new mutations, more than 33 mutations. I heard more than 50 mutations, possibly. And so they're studying that. And so they've been quiet about that lately. And I guess because they're trying to take this one step at a time. But that's just to forewarn you that even though this one they claim is a lot less, deadlier, think about it. It's affecting a lot of people, and it's spreading even quicker. And it is going around the vaccine. And I feel like that article I was reading where it said that it's a dress rehearsal for what's to come. I believe something worse is on its way. If it isn't even started yet, it probably hasn't. We don't know it just yet. They're monitoring all of this. And so even it goes on to say the deaths could have been spiked as high as 21,000 per day. Think about it. This is what they feared. So that's about 6 times the January 2021 peak, about 3,400 deaths a day, according to the data. This is from Johns Hopkins University. So even 2.6 million COVID-related hospitalizations that occurred during 2021 placed an enormous strain on the hospital, with many staff lost. Not only the virus, but also the exhaustion and the burnout. Faced with such unprecedented demand, the U.S. hospitals operating under crises standards of care would likely have been no choice but to turn away tens of thousands of even hundreds of thousands of individuals. So this is what would have happened to draconian measures where they have no room for any more sick patients. That's when fear has gone to a whole nother level. It is survival mode. And that's what they were trying to prevent. But look what's happening right now. Right now we have one that seems like it's inconspicuous and it's not really killing anybody, but it is contagious even more so than Delta. I feel like whatever this thing is, it is learning its way around the vaccines and it's doing a good job of it. And now it's opening up more people to get sick and to possibly see a wave of more infections, which just already started. And then after that, death. And what they were trying to prevent probably will still happen. So I'm just letting you know that this Omicron is nothing to mess with either. Because the vaccines, even if they're there, they only provide only a certain level of protection to a certain percentage. And then if you are already sick with other diseases, other things that could hinder you, the vaccine only provides somewhat of a layer of protection, but it's not foolproof. But it's better to have something than have zero, is what they're basically stressing. Researchers from the Commonwealth Fund built their model using published data about the vaccine effectiveness and the pace of the vaccinations, as well as the timeline and the characteristics of the original coronavirus strain. The 3 variants, which was Alpha, Delta, and Lambda. And so they assumed that the increased social activities, as well as reopening the businesses and schools, would have moved forward consistently, even without the introduction of vaccines. And so our findings highlight that the ongoing tragedy and preventable death and hospitalizations occurring among unvaccinated Americans, the research wrote. As immunity wanes, the breakthrough infections continue to emerge. This is what's happening now, and it is clear that we must vaccinate and give the booster shots to many more people, building on tremendous, though mostly invisible successes of the U.S. vaccination program has accomplished thus far. So some more content on this is according to the U.S. Disease Center, CDC Center, Disease Control and Prevention, the risk of dying from COVID-19 is 14 times higher for unvaccinated people than it is for those who are fully vaccinated. And so, and cumulative hospitalization rates for adults are also about 8 times higher among unvaccinated people than they are among fully vaccinated people. So now, 1 year into the vaccinations in the U.S., more than 202 million people, about 61% of the population, are fully vaccinated. According to CDC, overall throughout the pandemic, the U.S. has reported more than 50 million COVID-19 cases and about 800,000 deaths, according to JHU. And so that's basically what it says. Biden says that he encourages promising data on Pfizer and COVID-19 antiviral pills. So they're basically trying to work on that, but that's where we are. And according to the latest. So doesn't look like this is going to go away. Like I said, I just wanted to clarify that. And so where we are on this new variant, it seems like it's spreading a lot faster than any of the other ones prior to it. And so all we can do is wait and see what happens next.